Welcome to our webinar, Finding Opportunity in Crisis, How to Use COVID-19 to Build Better UHC Systems in Africa. I would like to welcome His Excellency Jakaya Kikwete, former President of the United Republic of Tanzania, Her Excellency Amira Fadil, Commissioner of Social Affairs of the African Union, Dr. Mwete, Regional Director of WHO Afro, Dr. Naveen Rao, Senior Vice President of the Health Initiative at the Rockefeller Foundation, Dr. Marianne Etibet, Lead and Executive Director, Merck for Mothers, and the Director of the Africa CDC, Dr. John Nkengasong. Each of these leaders is playing a critical leadership role in the current pandemic. We so appreciate your taking precious time to help us all understand our collective next steps. I would also like to welcome Ms. Stephanie Friedhoff, Staff Director of Harvard's Global Health Institute, who is a key strategic partner. Ms. Friedhoff and her colleagues have worked with our team to create a groundbreaking report of the various sectors of government needed to achieve UHC. This analysis grew out of our UNGA UHC conference last September, where we welcomed a record-breaking number of participants. These participants came from every sector. They demonstrated vividly how impossible it will be to achieve UHC without ensuring equitable access to the fundamental pillars of health, including nutritious food, clean water and sanitation, clean air, and reliable, sustainable energy. COVID-19 has communicated a sense of urgency to world leaders of the need to address inequities in health access. The structural inequalities in the US, in particular towards the African American community, are rising to the surface. There has been global solidarity and a collective call for equality as citizens put their own health at risk and stand for justice. Universal health coverage is a call for health access, but it is also a call for equity and justice. Everyone, from refugees to mothers to persons with disabilities, deserves access to health as a basic human right. There is opportunity in this terrible crisis. It is the opportunity to meaningfully ramp up the level of political commitment to UHC and to mobilize the sectors outside of health to provide equitable, accessible health for all. Fortunately, in Africa, we have the strongest of leadership in this fight. His Excellency Ramaphosa has been leading the African Union's response to COVID and in the health system strengthening necessary to fight this pandemic and to avert the next one. Dr. John Nkengasong, Dr. Benjamin Njulabai, and the Africa CDC have demonstrated enviable leadership against COVID by calling for and helping to build diagnostic and disease surveillance capacity across the continent. We are currently working with the Africa CDC and the AU to bring attention to Africa CDC leadership and to put essential communications tools into the hands of millions of Africans across the continent. His Excellency President Kikwete, Her Excellency Amira Fadil, and the Africa CDC have joined us in our One by One Target 2030 campaign, which is meant to mobilize head of state commitment across the continent. Our campaign leader, President Kikwete, has long been eloquent in pointing out the critical need for head of state leadership if we are to move the needle on UHC. As we have so painfully seen during this pandemic, extending health coverage universally is an inherently political process. UHC is impossible without leadership from heads of state. Thank you for coming today. Please allow me now to introduce some comments from one of the most critical leaders in the fight against COVID and in the fight for UHC. Please welcome Dr. Rebecca Mwete, Regional Director of WHO Afro.
Your Excellency, Dr. Jakaya Kikwete, former President of the United Republic of Tanzania, Excellency, my sister Amira Fadil, the Commissioner of Social Affairs of the African Union, Ms. Kate Kampana, CEO of the Access Challenge, distinguished colleagues, I'm very pleased to share some reflections in this important discussion, and thank you very much, colleagues at the One by One Target 2030 campaign, for inviting me. I'd like to start by appreciating the strong leadership of the African Union and the heads of state on the COVID-19 response through the continental strategy and all of government and all of society action in implementing public health and social measures. I'd also like to appreciate the contributions of African leaders towards attaining universal health coverage, including through the African Union commitment in February 2019 to improve financing for health. This commitment was reaffirmed with a political declaration on UHC at the UN General Assembly in September last year, and heads of state support for the Global Action Plan on the SDG 3, whose implementation WHO coordinates. It's our firm belief that everyone should have access to quality health care without suffering financial hardships. The COVID-19 pandemic has once again highlighted that countries with less resilient health systems and the most vulnerable, marginalized communities and households suffer more in terms of lives lost and economic impact due to outbreaks of infectious diseases. Building on investments from previous epidemics, African countries took early and decisive action with the support of WHO and our partners like the Africa CDC. Capacity is strengthened through Ebola preparedness, such as emergency operations centers, points of entry screening, and laboratories have quickly been adapted and repurposed to the COVID-19 response. By reinforcing public health and health systems capacities, along with physical distancing measures like stay-at-home orders and stopping mass gatherings, African countries have kept COVID-19 cases lower than in other parts of the world. Now, as countries ease restrictions, every community should have the public health capacities in place to prevent a big wave of cases. Health facilities should have the resources, including access to safe water and sanitation, to deal with COVID-19 cases while continuing to provide other essential services. We are seeing huge investments related to COVID-19, and this is creating several possibilities and opportunities to accelerate action towards achieving health for all. At WHO, we've been working with countries to spend more and spend smartly on health by investing in the most impactful interventions, improving efficiencies in the health sector, and strengthening public financial management. Multi-sectoral planning and coordination is now ongoing in countries in response to COVID-19 under the leadership of heads of state. This needs to continue in order to advance broader discussions around financing and priority setting. Laboratory capacities have been strengthened and equipment from other disease programs has been repurposed to COVID-19. Going forward, we should look to shift away from disease-specific approaches towards more integrated laboratory systems in countries. Similarly, infection prevention and control is important in general healthcare settings. If we can regularly refresh the skills and knowledge built for COVID-19, provide the equipment and supplies, we have the potential to significantly reduce nosocomial infections in Africa. We're seeing countries like Ethiopia, Mauritania, and South Africa mobilize thousands of community health workers to support the COVID-19 response. How can we sustain and transition these investments to benefit other priorities? And then field hospitals have been set up quickly and buildings have been repurposed. We are also seeing home-based care for people with mild symptoms and new approaches in providing outreach care and delivering mass campaigns. The lessons from these experiences should inform the provision of services in future so that we can continue to expand access to integrated, people-centered care. This includes using technology in a range of ways, from telemedicine to professional development. For instance, more than 10,000 frontline health workers in Africa have joined virtual trainings led by WHO on intervention areas such as case management for COVID-19 and psychosocial care. We are also seeing the potential of social media and messaging platforms in sharing information with communities. We need to look at how to build on these and other efforts to engage communities, for instance, in seeking antenatal care, routine immunization, or antiretroviral therapy. A huge amount of data is being collected at present, and real-time surveillance platforms using geographic information systems technologies are being increasingly useful. We can make sure that data is collected, is managed in a timely way to guide decision-making and action for health provision more broadly. These and other innovations are key features in this response. At WHO, we provided seed funding to African innovators to develop mobile apps and low-cost personal protective equipment, for example. Together with governments and the private sector, there is an opportunity here to invest in the innovation ecosystem to reduce the time it takes to bring new ideas to scale. Further, in a context of disrupted global supply chains, local production has ramped up. This is an opportunity to strengthen local industries and routinely produce essential supplies domestically. We have seen that this is possible even in low-income settings. The pandemic is also highlighting the important role of the private sector in collective action to achieve UHC, and it provides an opportunity to build strong public-private partnerships for emergency preparedness, response, and other health service areas. Finally, this pandemic has shown beyond a doubt the importance of all of society approaches in health. In solidarity, governments, the private sector, communities, and partners can shift from short-term investments towards sustained improvements in resilience and readiness capacities. In closing, it is very encouraging to see African leaders in both the private and public sector present here today, leading the way on UHC. I'm convinced that together we will overcome this pandemic and build back better to make health a reality for all people in Africa. I thank you very much.
Greetings from Chatham House in London, a switch of continents. And I think that we're going to have the panel first, I think, before we move to the presentation of the report. And we were thinking about doing this anyway. Just to explain, my name is Robert Yates, and I'm the Executive Director of the Centre for Universal Health at Chatham House. And we have a particular interest in universal health coverage, and especially the political economy of universal health coverage, recognizing, as Kate was saying, how important political leadership is to achieving UHC. And I think we're seeing across the world at the moment, that in every single country, heads of state are under pressure to deliver and ensuring everyone gets the health services they need, but also with financial protection. That one recognizes that a lot of health services are expensive, and that poor people aren't usually getting health services. So there has never been a better case for universal health coverage. And we have with us a fantastic panel today who are all sort of pioneers and experts in universal health coverage. Their organizations have been at the forefront of the universal health coverage campaign, and especially they as individuals have been very prominent in the campaign. So I can't think of a better group of people to discuss this very important topic, really, which, as Kate was saying at the outset, how do we use this COVID-19 crisis potentially as an opportunity to catalyze universal health coverage reforms? And we're seeing this potentially happening all over the world. So just to very briefly introduce my panel, and I don't think I could have a better panel. First of all, we have His Excellency Dr. Jakaya Kikwete, who is the former president of the United Republic of Tanzania and championing universal health coverage on the continent of Africa. We also have Her Excellency Amira Fadil, who is the African Union Commissioner of Social Affairs. We have Dr. Mary Ann Etibet, who is the lead and executive director for Merck for Mothers. And finally, we have Dr. Naveen Rao, who is the senior vice president of the health initiative at the Rockefeller Foundation, with the Rockefeller Foundation, I think, being one of the pioneers of the whole UHC movement. So the way that we're going to organize the panel is that I'm going to ask each of our eminent panelists a specific question on a key topic of interest to them, and they'll speak to us for about 5 minutes or so, and then we're going to have a discussion amongst the panel to sort of flesh out some of the points they've been making and hopefully link those points together. But we're also very, very keen that you, the audience, ask questions of our fantastic panel. So we might ask that if you can use the Q&A function to ask questions, so not in the chat, but to use the Q&A function, and my colleagues are then going to collate questions and feed them to me, and then we'll put them to the panel in roughly sort of half an hour or so, something like that. So, so please feel free to ask at any time, and any of the panelists. So, if I may, first of all, turn to President Kikwete, and I know that you are very much looking at generating political commitment from heads of state to universal health coverage. And I was just wondering, why do you feel that bold political leadership is so crucial at times like this in tackling not only COVID-19, but potentially avoiding pandemics like this happening in the future? President Kikwete.
Important.
Yes, thank you.
Well, I can say it's the alpha and omega, because essentially the responsibility of ensuring good health for the citizens is the responsibility of the political leaders of a country. So when we talk about promoting universal health coverage, essentially we're saying that everybody has to have equitable access to health care without hindrances, without encumbrances. So in the developing world, this essentially is the responsibility of the state. States are the ones that are building dispensaries in the villages, building health centers, building hospitals. States are the ones that are providing health professionals. They are responsible for ensuring that those hospitals are well equipped with with all the equipment that is needed, with the medicines that are required, with the health professionals that are required. So when you have strong political leadership that is committed to seeing healthcare improved in the country, that is the prerequisite of ensuring universal health coverage. Of course, there are challenges. For example, from my experience with countries like ours in the developing world, where the availability of health delivery centers is not evenly distributed. You have places where the centers are 20 kilometers away. So how would you make access to healthcare delivery to everybody? It means increasing the availability of centers close to where the people live. It's an investment. It needs deliberate decision and action and investment by governments. As I said, you need to equip those centers. You need to have the health professionals and so on. You have to train them. You have to employ them. You have to put them in place. But of course, with in the case of Tanzania, with the structural adjustments and the introduction of user charges for healthcare, for water, for education, and so on, then a situation has arisen whereby people have got to pay for healthcare services when they visit these hospitals. And when it is poor people, if they can't afford, then what do you do about that? When you talk about universal health coverage, everybody has to have access. In fact, I have a practical example. Just 2 days ago, one man from the village had his daughter who had complications in birth, the stillborn, and then she delivered in the village setting under the care of traditional birth attendants, because the hospital facilities are far from there. And then she had problems of bleeding. So they had to refer, I had to have her referred to our referral hospital here at the National Referral Hospital. Then he was asked to pay 600, almost 700,000 shillings here in the Tanzanian case, and the poor man could not afford. So he comes back to me. He said, President, and I was a member of parliament for the president, my former member of parliament, my former president, please help me. So I had now to reach out to the authorities in the government, talk to the Minister of Health, but talk to the director of the hospital, and he said, leave that matter to me. So they looked for concessional ways. So lucky this man knew me, and I was able to link him with the authorities, those who don't know anybody to help them. That is where you find people fearing to go to the health delivery centers, people who are there who cannot pay. In fact, this lady, if that money was not paid, should have been detained at the hospital. There are cases where people die, and because they have not paid the bills, they cannot take their bodies. So you have these kinds of situations so looking at the best systems, whereby people cannot be encumbered by issues of financing for their personal health is one of those things that we think universal, when advocating for universal health coverage, we are talking to leaders to look at modalities, the modalities of making sure that people are not encumbered from getting health care because they are poor and they cannot pay for that. So putting in place the health facilities, the health professionals, and ensuring that there's enough medicine, that's a part of the state, but also putting in place systems that can make even the poor access healthcare is critical when we're promoting universal health coverage on the continent.
Right. Thank you very much. And I think you make a very important point about the need to remove financial barriers, and you know that this was one of the huge failings, I think, of development policies of the 1980s to impose healthcare user fees on many countries, particularly in Africa. And it's very significant, I think, that WHO now are calling explicitly to remove healthcare user fees, particularly during the COVID-19 crisis. And so I think we're seeing a complete sort of reversal of policies there. And it's a very, very important point, I think, for leaders to follow. And I think it's very significant, the role of the African Union in this big debate. And we've already heard mention of President Ramaphosa in South Africa taking a big leadership role. And I've seen his attempts to tackle COVID-19 getting a lot of international plaudits, particularly at WHO. So anyway, to talk about the African Union and specifically your attempts to sort of try and have a unified African position on this, I think it's really admirable that the AU is championing universal health coverage as the best strategy to tackle the pandemic and improve health security. So can you maybe give us some indication of what you're trying to do at the AU to push forward this agenda?
Thank you very much, moderator. And on behalf of the African Union Commission, I would like to start by thanking Access Challenge for organizing this very important webinar on universal health coverage. And my greetings here from Addis Ababa. Addis Ababa time, it's good evening. And let me also appreciate His Excellency, former President Kikwete. He's always at the forefront on promoting health issues in Africa. And it's always good to see you, Excellency, Kate, and all the participants. I'm glad to be part of this webinar. We are just talking about universal health coverage, but because we are in the mid of this pandemic and this crisis of COVID-19, we want to use this opportunity. And we all know that in every crisis, there is always opportunities. So the question being raised in this webinar is how to use this opportunity to promote universal health coverage. And not only that, primary health care as a related issue to universal health coverage. In our previous engagement with Access Challenge, and with His Excellency Kikwete and Kate, we spoke a lot about these issues. And the last time when we met on the sidelines of our summit, February summit also, we spoke and we engaged in a long discussion, and we agreed on the steps to be taken in this area. The African Union decided from the beginning of this COVID-19 crisis to act in unity and in solidarity. And as just been mentioned by you, moderator, that the chair of the African Union, Excellency President Ramaphosa, and the chair of the Commission and the Bureau of the Assembly of the Heads of States and Governments met 5 times since the beginning of this COVID-19 in Africa. And also we know that Africa was delayed on having this COVID pandemic. The first case in Africa was in the 3rd week of February. But since the beginning of March, there is regular meetings for the Bureau of the Assembly. They decided on the leadership to be driven by the African Union and the African Union Commission. They decided that the Africa Center for Disease Control and Prevention, as a leading technical agency of the African Union on fighting epidemics in Africa, to lead on the technical level, to lead this fight. And on the political level, the leadership is following up very closely. As I said, there is a regular meeting of the Bureau of the Assembly. Heads of states and governments are making pledges. They decided to establish anti-COVID-19 response fund. And while I'm speaking to you, the fund is up and running. They made pledges themselves. There is 9 African member states. They made pledges to the fund. They decided to support the fund and at the same time to support directly the activities of Africa CDC. This fund now have a board of trustees. It's been chaired, or the elected chair is the president of the Afro-Exim Bank. And part of the job of this fund is to do pool procurement for medical supplies for African member states. The second objective of the establishment of the fund is to enable Africa CDC to send volunteers, experts, and responders to member states upon request. And that's what we are doing. We already deployed volunteers to member states. We are recruiting in some member states who are using our AVOC group, which the volunteers that supported the African Union during the Ebola outbreak in West African countries. So the issue of the financial resources, which is always a challenge when we talk about the implementation of our continental health policies, when we talk about our catalytic framework, our policies on nutrition, it's always a challenge. We started in February 2019 by having the African leaders for health investments, and it was a very successful initiative. We are continuing on encouraging more local resources from within our member states. But now when we faced with this epidemic, with the pandemic, we also faced with a resource challenge, how to have more resources to fight COVID-19. That's why the establishment of the fund is part of the solution. It's not the solution, but it's part of the solution. Also, I should appreciate here, while I'm talking about resource mobilization, I would like to appreciate the partners, the global partners, because this fight also is a global fight. It will not end anywhere unless it ends everywhere. Nobody will be safe if not everybody is safe. So it is the solidarity we decided upon in Africa. It should be a global solidarity. We should have this global solidarity. What we are having right now, we are having support from our partners, whether from the UN agencies or the international organizations. I don't want to start naming some of them because there are many, and I can say that there are too many to be counted or to be mentioned, but I do appreciate the partnership, and I do appreciate the resources that's being provided by our global partners. My second point is how to give this leadership to the Africa CDC. Africa CDC is a new institution at the African Union. And let me say also here that the African Union is well known on the leadership in the area of strategies, continental policies, the power of the African Union in convening member states, in taking political decisions. This is all well known and well appreciated by our member states. But to move into the area of implementation, this is something new in the last few years. To have our own institutions, which is a lesson learned also for us when we were faced by Ebola outbreak. That's why we have now Africa Center for Disease Control and Prevention as an institution that has the capability and the ability to implement the policies. We have our joint continental strategy on COVID-19, which is approved by Ministers of Health in an emergency meeting on the 22nd of February, and later been endorsed by the Bureau of the Assembly. We are implementing now this strategy. Africa CDC is on top of the implementation with our member states. We have a technical task force in which all member states are represented on the technical level. On the political level, our heads of states, they decided on creating coordinating committees. So we have a coordinating committee for the Ministers of Health, and in which we have all the 8 RECs represented. And NEPAD also is represented in the committee, but also we have a coordinating committee for the Ministers of Finance and a coordinating committee for Ministers of Transport. These 3 ministerial coordinating committees are the committees that is working on the political level to implement the continental strategy on COVID-19. We are at this time, and this is one of the opportunities we are using amid this crisis. We have a big gap when it comes to medical supplies and medical products. Very few of it is produced locally in Africa. So we are using this opportunity of COVID-19 to encourage more local production of medical commodities and goods in Africa. And that's why also there is a decision that if there is any product, any medical product that is now produced in Africa, we are not going to look for it outside Africa. We are not going to purchase outside Africa. And this is part of encouraging our local productions, and we are using this crisis to make sure that we will build the capacity of our local manufacturers. And this goes also for the area of the pharmaceutical industries. In the pharmaceutical industries, it's not new to you to know that we are working on the establishment of AMA, Africa Medicine Agency. We know that also there is a big gap in the area of medical products, of medicines. We are in the process of establishing AMA. It's as much needed as Africa CDC. And I think if there is one thing we should emphasize, we should hammer on, we should push, is the acceleration of the processes of establishing of our Africa Medicine Agency. Because we know if we have this agency, Africa will be protected from being a dumping ground to substandard, falsified, and fake medicines that are dumped in Africa. We will have a regulatory body that will regularize and harmonize our policies in the area of pharmaceutical industry. And I think this opportunity is an opportunity for us to push with our member states that they should sign and ratify AMA. We need 15 member states to ratify, so AMA can come into force. And I believe by 2020, this very important agency will be up and running. My third point is to say that to link this crisis to the area of universal health coverage and primary health care, we are also pushing the implementation of our policies in this area with our member states. And we are using also the opportunity of COVID-19 by diverting the resources to strengthening our health systems in Africa. because we know there is weaknesses in our health systems. And unless we have a strong health systems and also strong health institutions, we cannot talk about access to service. We cannot talk about having primary health care policies in place. We cannot talk about universal health coverage if we don't look even to the social also measures for having health for all as a program, not only on the continental level, but also on the national level. So what we are doing now, we are supporting more our member states. We are supporting the capacity of our laboratories and surveillance systems in member states. We are conducting more training and capacity building in the area of diagnostics, in the area of tracing, in the area of testing. We are using the opportunity of doing more trainings. We started before the lockdowns to do it physically by bringing the participant to Addis or different member states in Africa. But after the lockdowns, we turned to the online training, which we are doing it as a regular programs, and it depends also on the needs in our member states. We are also using this opportunity to share more information and data sharing. We created platforms for sharing data between our member states. We are creating platforms to share experiences between also our member states. And we are introducing new initiatives that's related to COVID-19, like PACT initiative. PACT is Partnership for Accelerating Testing in Africa. It calls for more testing, tracing, and treatment, plus isolation of the infected persons. It is an initiative that launched by our chairperson of the African Union Commission, but it was rolled out yesterday by myself and the director of Africa CDC. It is a very important initiative. We are targeting 10 million tests in Africa, but our expectations that our member states will even do more than the 10 million that's going to be conducted by Africa CDC in collaboration with our member states. The second information I would like to share with you before wrapping up my, statement is the electronic platform. Also, it is a decision made by the Bureau of the Assembly, chaired by President Ramaphosa. He invited business leaders in Africa, and also let me here appreciate the role of the African private sector. They are fully engaged with us in this fight. They are part of the creation of the fund, Anti-COVID-19 Response Fund. They have made pledges to the fund, and Strive Masewa, as one of the business leaders in the continent, has been assigned by President Ramaphosa to create an initiative in the pool procurement area. So he, with his team, he created an electronic platform for medical supplies in Africa. It's already been established. The application also is already been tested by some member states. They decided on the manufacturers. They secured upon projections the needs of the continent with the manufacturers, because we know that there is a global competition on buying this medical equipment. So this platform, they secured for Africa what it needs, what member states needs. They also secured for us the lowest and negotiated the lowest prices possible. And through this electronic application, African member states, they can access, they can purchase, and there is also an agreement on which airlines also to deliver. So this platform was just endorsed 2 days ago by a joint ministerial meeting between the Ministers of Finance and the Ministers of Health of Africa. They endorsed it. Some member states, they already started to purchase. These are just brief informations. I would like to share it with you in this webinar. But I said that we are using these opportunities that's been created by the COVID-19 crisis to strengthen our health systems in Africa, to accelerate the implementation of our strategies in the continent. My last point is Kate and former President Kikwete, that we are committed that the outcomes of our meetings and the last one in Addis Ababa, that we will put the proposal in front of the Ministers of Health in the coming meetings. And I spoke with Dr. Margaret, who is also part of this webinar, that we will organize a meeting, or we can use the meetings that are organized for COVID-19 to put our proposal on the universal health coverage for it to be endorsed by the Ministers of Health. And when it is endorsed by the Ministers of Health, then we can take it to the specialized technical committee, and it will be
fantastic. Thank you very much indeed.
This is just an announcement I'm making, and I'm sorry if I'm long, but I just wanted to share with you as much information as I can, but there is a lot to be said. And I would like you to visit our website, Africa CDC website. We have guidelines on easing lockdown. We have guidelines to member states on different issues regarding COVID-19. Thank you very much.
That's wonderful. Thank you. And obviously so much going on, you know, and I think really commend the Africa CDC and the AU for really sort of showing such tremendous leadership and really finding African solutions to the problem. And you mentioned there the very important role of the private sector and engaging the private sector throughout the continent. And who better to bring in now than Mary Ann, who is an expert on the role of the private sector and her role of working for mothers. So Mary Ann, how important do you think public-private partnerships are to achieving universal health coverage in Africa and tackling the pandemic?
Yeah, no, thank you so much for the question, Rob, and thank you, Kate, and everyone on the line for the opportunity to have this important discussion. I think it's so critical that we're here having it, because it's not just about how we make the right decision for the moment. It's about how we make the right decision in the moment for the future. And it's the future of all of us. It's the future of our SDG goals, of our universal healthcare coverage goals. And really, when we look at what's happening outside on our streets, you know, it's the future of our democracies and our humanity. And at Merck for Mothers, you know, we were created back in 2011 with a $500 million commitment by Merck to help end preventable maternal deaths. And when we look at what's happening in the world around us, these goals are going to be challenged, especially by COVID. You know, we are seeing models. We actually don't even have to look at the models. We are seeing in real time the disproportionate impact COVID is having on women, girls, and minority populations. We're also seeing the impact COVID is having indirectly on other healthcare goals and the ability to stay healthy because of the reduction in essential services. And the point I actually want to make about the fact that we all need to mobilize, and we are doing that, that's why we're on this call, mobilize and build momentum about ensuring that essential services continue. It's not just about the supply of those essential services and how we work across sector, private sector, public sector, civil society, to ensure that those essential services are available for communities and people who need them. But it's also about making sure that we are connected to people who are living in these communities so that they are not afraid to actually access the services, that we are getting the right information to them at the right time for their specific needs so that they can make the right decision about health-seeking behavior. You know, one of the things that this has been highlighting for Merck for Mothers and our families of partners around the world are two things. Not just how important it is to work together across sector, private, public, civil society. We have many of the representatives of many of those aspects of society here on this call. How we can use the capacity of the private sector to augment government capacity so we can ensure essential services continue. The point I want to make, it's not only about the private health sector, but thinking outside health. Folks on the call or the webinar have already talked about the importance of an innovative ecosystem and creating an enabling environment for that. The political leadership we have here on this webinar is critical for that. Without that enabling environment for innovation and the ability to quickly translate that innovation into impact and make sure that it gets to everyone that it needs to get, we're going to need political leadership. We're going to need groups like the Access Challenge helping us work through what types of policies will help in this enabling environment. And last but not least, we're going to need all of our partners to make sure that the innovations actually get to the folks who need them. If COVID has taught us nothing else, it's taught us that health systems don't end at the facility. They end at the patient, wherever the patient is. And in today's world, more likely than not, the patient is at home in their community. So how is it that we get to them, whether it's through community health workers, whether it's through digital platforms, and working across sectors, bringing in tech, bringing in banking, bringing in manufacturing, to make sure that those connections and those ties to people and families in their communities stay strong, so that they have the information and the data that they need to take care of themselves. I want to bring it up a level. You know, that's talking about those micro connections that have actually already, in fact, played out on this call. You know, so if we see how technology, how important technology is just to have a conversation, how important is technology to stay healthy, and the investments that we need to make now to create that technological and digital infrastructure so that data can flow, so that information can flow, whether it's health information, whether it's financial information, so we can build a strong infrastructure that will allow for successful universal healthcare coverage. Because the aspects of universal healthcare coverage are not just about access and availability. We have to ensure quality is part of that equation, and we can't ensure quality is part of that equation if we don't have real-time, transparent data around quality of care to make sure that we're actually creating value for the communities and populations that we hope to improve their lives through universal healthcare coverage. So I'll end there. Thank you, Rob.
Thank you very much indeed. And I think, everything's happening so fast with the technology as well, I think, and health, that my two children have both had GP appointments this week via video calls that, that they would never have had before, and they've been very successful. And I think, that much as this COVID crisis is a disaster, we are seeing, sort of potential for rapid change going forward. And so I think there are silver linings, and this is very much, the topic of our conversation today, about how do we make the best of this opportunity. And if I may sort of turn now to Naveen and the role of philanthropists in this, and I mentioned at the outset, I think we should all thank Rockefeller Foundation for very much being at the forefront of the whole UHC campaign. I think it was back in 2009. It was your predecessor, Ariel Pablo Mendes, I should say, who wrote a great paper about all for universal health coverage that I think many see as the sort of the birth of this movement. But Rockefeller has done a lot of work on UHC over the years, and your program has been evolving. What do you see as the role of philanthropists, and particularly maybe sort of around precision health and data in the debate about health? Or Naveen, you just need to unmute. Sorry.
You'd have thought I would have learned by now. Thank you, Rob, and I do thank Access Challenge and the Harvard Global Health Institute and their partners and everyone on the panel along with me for this opportunity. There is an advantage to coming last on a panel. I think of the points have been made, and that allows me to weave my comments between the gaps that make sense, that have not been said, or make sure that I highlight what is important from a philanthropic point of view. So I will curtail my comments to the question you asked, Rob, which is what role can philanthropy play here? We've heard the role of governments, we've heard the role of multilaterals, we've heard the role of private sector, and now it's appropriate that we hear the role of philanthropy in this context. So I will keep it to that, and I'll also make sure that I keep to time, and I also keep it to how can COVID and the response to COVID help strengthen primary health care towards universal health coverage, because eventually that is the goal, and we don't want to lose track that the holy grail here is the universal health coverage. So I'm going to try to keep it within that. I appreciate this opportunity. I feel that philanthropy plays a unique role in that it can provide the convening platform to bring the various sectors together. That philanthropy usually has enough freedom and financial resources to be able to play that trusted convening role to bring people to the table, so to speak, and be the intermediary and be that trusted partner from the government's point of view, the private sector, and the civil society. So I really do feel that philanthropy can play that role. And in fact, that is the role philanthropy should be playing. So let's take, for example, the role philanthropy can play in some of the issues that were brought up by the other panelists in terms of not having access to quality PPEs, protective equipment, not having quality access to testing, and the latest and best in terms of data technology to be able to stitch these together. And I dare say it is there. Right now, we haven't said it, but within a year, we will be talking about when the vaccine comes available, where in the line is Africa and the African Union and the African countries when they are going to get the vaccine. And we've heard nobody is safe till everyone's safe. So this is really important. And this is the kind of role philanthropy can play is, for example, through financial instruments, philanthropy can get involved with pooled procurement. Pooled procurement is basically guaranteeing volumes so that we can reduce prices. To have such kind of financial instruments that will allow pooled procurement to happen, specifically right now with testing and with PPEs and vaccines when it goes down the road. But we know by itself, testing and tests and vaccines when it comes is not enough. We do believe the power of data and data technology and harnessing that and bringing that, and how can we work with that in real time. And it's amazing, I sit here and I remember when it comes to data technology, I remember my professor of obstetrics and gynecology, and I'm going back maybe 45 years ago, where she said, we cannot predict which pregnancy is high risk, and hence we have to deal with all pregnancies as high risk. And so we didn't have any predictive analytic tools among which of the pregnant women were high risk. And that was 45 years ago, and I can understand. But if you look at our lives and how they have been disrupted positively through technology, for example, I say it lightly, but it's probably true that Netflix knows which movie I'm going to watch before even I know which one. They have that predictive analytic capabilities of predicting which movie I'm going to watch tomorrow. The weather forecast app has the predictive ability to tell me whether it's going to rain on my head wherever in the world I'm standing. If really we've come to the 21st century and predictive analytic tools, and we see it all over, whether it be the GPS or banking, music, why is public health still stuck in the 19th century? I mean, still today, we don't have predictive analytic tools to say which pregnancy is high risk with some accuracy. So I really do believe focusing on data technology is really important. And I truly believe Africa can leapfrog here because it's not burdened with traditional forms. And so if we get this right, and we should get it right collectively, and that's a role philanthropy can play and bring the right partners to the table. And you asked about precision public health, and this is the focus we have at Rockefeller. And we really believe that if we can bring all this together, that is the role of philanthropy and Rockefeller. We just made 3 grants in Africa to be able to do this. We have a grant with emergency operating centers, try to see how we can work with that because we know emergency operating centers save lives, they've proven it. We're trying to work with Dimagi and Datakind, Dimagi and Medic Mobile, who work with community health workers. How can we get apps into the hands of community health workers that here and now can beef up contact tracing and the testing and community health with education, and how can we get them the tech tools they need? And also we are working to see how we can bring energy. A full 70% of health facilities in Africa do not have access to reliable electricity. How can we get mini grids and power going so that these health facilities have the kind of energy? So we're looking at it from a surround sound. I'll stop here. There's many roles philanthropy can play. Rockefeller is proud and humbled to be part of this journey. We believe that if we get this right in Africa, it's a benefit to humanity. And so we're committed. And anytime President Kikwete invites us to a meeting, we will show up. So thank you.
Fantastic, thank you very much. And you mentioned, the importance, I think you said, of bringing public health out to the, the 20th century into the 21st century. And I think we recognize there has been this problem about public health services not really being particularly well integrated into universal health coverage and the need to have more resilient health systems. And I'd perhaps like to address this with the panel now, and perhaps turn first of all to President Kikwete, because President Kikwete, you were chair of the UN Secretary General panel after the Ebola sort of crisis in West Africa, and you learned a lot of lessons there. I know that you were advising WHO about this, and we had at the UNGA last year the Global Preparedness Monitoring Board presenting about the need to invest in more resilient health systems. So what do you think that we should be doing, coming out of this crisis now, to make systems more resilient going forward?
Well, thank you. Well, it is true that in April 2015, I chaired a high-level panel appointed by Secretary General Ban Ki-moon. Of course, it was formed after the outbreak of the Ebola crisis in Guinea, Sierra Leone, and in Liberia. But we were tasked to identify and recommend ways to make the world prevent and respond better to future pandemics. It was not only confined to the Ebola. We were asked to look at Ebola as a basis of how the world responded, and what lessons have we learned from that we can use to identify better ways the world can respond to the Ebola, to a pandemic of the Ebola, like the Ebola or any other pandemic. One of the things we observed in this is that one, weak health systems. Now, the weak health systems have been a problem in the three countries. Of course, most of them have come out of crisis, but weak health systems have been one of the major problems. But when we look at the developing world as a whole, there are weak systems all over the place. This is typical of the developed world. So we said one of the recommendations that we said is, let us find ways of strengthening health systems in the developed world, in the developing world. Because if these systems remain weak, in the event of an outbreak of another pandemic, these countries will not be able to manage. But the other important aspect, which is related to the health systems, there are international health regulations. International health regulations, which talk about core capacities that countries must build in order to strengthen their capacity to respond, to prevent and respond effectively when a crisis happens. And surprisingly, there are signatories, now 196 signatories to the IHRs, but only 60 were compliant worldwide. So if only 60 are compliant, which means that in the event of an outbreak, many of our countries will not be able to respond effectively. So no wonder when the COVID outbreak came out, then it played out clearly that I think the non-compliant to the IHRs has been one of the factors. Of course, there have been discussions appealing to countries to be compliant. One of the recommendations that we made is that come 2020, all state parties to this should be compliant. And of course, we made the recommendations on how to trace, to track compliance among states. Of course, that don't be too much to recommend here. But that is another important aspect, because in international health regulations were created in response to crisis, in response to pandemics. And the core capacities that have been prescribed there, which countries must have, so as to build capacity to respond to when a crisis happens. This important aspect has not been observed. So, of course, we looked at other aspects which became evident in our observations. Then we looked at global response to the crisis. So that was at the internal level. At national level, we have building strong health systems, but also being compliant to international health regulations. Then we looked at regional level. Regional level, of course, the regionals have played important roles, like WHO, regional Africa, the African Union, for example, and the regional economic communities. African Union mobilized doctors, over 1,000 doctors who went to these three countries to work with the health professionals in those countries. So that's one thing that we said. There is a role at the regional level that can be played effectively. And I'm glad with the COVID response, as we have heard from Amira, that the AU again has been instrumental, assuming leadership, mobilizing, bringing African countries together to address this pandemic. That is an important point. Then we looked at the global level. We said the WHO is the institution. There is no other institution. There is no replacement for the institution. But how did the WHO respond when it came to the Ebola crisis? Well, of course, the response was a bit late, as everybody else was, but our recommendation has been next time around, when a pandemic, there is an outbreak of a pandemic, WHO has to respond faster. We saw that this has been observed when we had the Zika outbreak. Yes, WHO responded very fast. And of course, again, this time with the COVID, there's been a faster response by the WHO. But the other thing which was fundamental to the WHO is that it has been essentially a normative institution. It has not been operational when it came to crisis. One of our major recommendations has been that the WHO has to reinvent itself and build the operational capacities that in the event of a crisis, then the WHO would be able to assume leadership, operational leadership. So, of course, then the structures have been formed. There has been a special directorate that has been formed to deal with crisis, and there is a director, and there is leadership. And then, of course, we looked at the other aspect is about research and development of vaccines and medicines. One of the important observations made was that when it came to diseases that are predominantly in the developing world, there isn't much investment. There isn't much investment into research and development of medicines and vaccines for such diseases. That's why we find a lot of problems. Ebola has been around for quite some time, but until this huge crisis when 28,000 people got infected, 11,300 died, that's when there's been the activity now to deal with look at the issues of medicines and vaccines. But of course, the general observation has been, because it has been predominantly, the thinking has been it's an African problem, it will go away. So that's why one of the major recommendations is that a special fund should be created under the auspices of the WHO to deal with issues of research for vaccines and medicines for these diseases, which are predominantly that in the developing world, and there isn't much interest in it, so that to help the companies, the scientists to deal with the research. So these have been, so I can say this is what came out, and it was only, we presented our report in 2016, and this is 2020. Yes, it's only about 4 years ago when we present the report, and then we have this huge pandemic now coming up, COVID. So a lot of those issues that we have identified, like weak health systems in countries, non-compliance with the IHRs, and so on, and the building the capacity of the WHO to become a more responsive institution, a more operational institution when it comes to it. They played out as to have been relevant. So I'm saying, of course, after that, the WHO took up the report was discussed on, I think, on June 20th at the UN General Assembly. It was adopted, and the recommendations, and WHO has tried to restructure itself, to reform itself on the basis to take up a number of these recommendations, which has become more effective in terms of responding to pandemics, different from what it was, how it responded when it came to the Ebola crisis, because it took about 9 months before it was declared a pandemic. Mm-hmm. And so that now the world started responding actively, more robust way to address the problem. So I'm saying what we observed and what our recommendations and what is going on now in implementing the recommendations of the high-level panel is really relevant, and I'm sure if we can complete some of those issues which have not yet been implemented, I'm sure we'll have a better global health system which can identify and respond better when the pandemics happen.
Yeah. Excellent. Thank you very much indeed, President Kikwete. And I think, that we all recognize the vital role of WHO in being more operational like this, and therefore it needs more resources and it needs more power. And therefore the recent attacks on it being, absolutely a terrible affront to all of us, I would suggest. Marianne, I just wonder your views on, how we're going to make systems more resilient, and potentially this issue of, how do we integrate the health response more effectively with the public health and the health systems approach?
Yeah, no, thank you so much, Rob. I do think, as His Excellency mentioned, this is work many of us have been engaged in, not over years, but over decades. And it's the investments and the learning from Ebola and past epidemics, that informed how we invest in not just resilient health systems, but also responsive health systems. And I think that that's, a really special role and unique role that the private sector can play. Merck for Mothers has seen the ability of many of our local private sector partners, whether they be social entrepreneurs or local private providers, have the ability to pivot really quickly and respond, in real time to the new or different or intensified demands of their clients. And, when we think about strengthening health systems, it's the resiliency, it's the responsiveness, it's the adaptability, and private sector, does have a role to play around that. I think, there are two key things, just to reemphasize some of the earlier points. One is that enabling policy environment, to support an innovation ecosystem. And then the other one is, using technology, at least from my perspective, to make those connections between public sector, private service delivery, private sector service delivery, community health worker service delivery. Because at the end of the day, that woman giving birth, she is looking for the place that she can give birth that will be of high quality, that will give her respectful care, and that she will stay alive. She moves between different service points, whether they be private sector, community, or public. But her data doesn't move, neither does the financial data that supports her ability to access affordable care. That doesn't move. And there are huge inefficiencies in the system. And so unless we create these connections that allow for efficient and transparent flow of information so that we can hold all of ourselves accountable because we're seeing the same data and we are looking at it through the same viewpoint of results and health outcomes. I think that that's actually one of the possibilities that COVID creates. We are already seeing on the front lines everybody raising their hand to support government responses to the COVID pandemic. They're doing this in the moment. We have that phrase, necessity is the mother of invention. But how do we make sure that what is happening in the moment, that is strengthened and that can be sustained post-COVID, and that we also learn in the moment, so some of those things may work better than others, that we need to make sure they're not unintended consequences. We need to make sure that, innovations and access are uniformly deployed so that they do reach, that last patient at the last mile. So these are all things that I'm just, really excited we're having this conversation, and for Merck for Mothers, when we think about that ultimate goal of ensuring that no woman has to die during life, it's going to take all of us. And this decade needs to be not the decade where we're picking up the pieces, but the decade that we're actually accelerating action, towards those shared goals. Thank you.
Thank you. Thank you very much indeed. Now, I'm conscious that we've been having questions being posed to the panel by a very enthusiastic audience, which I think has been sort of about 250 people have joined, which is absolutely thrilling for us. And obviously, we have people from all over the continent. And there's one question that's particularly caught my eye, and I think very important to ask, is around the role of the youth and, in achieving universal health coverage. And Africa is a very youthful country and sort of continent that with so many young people, keen to sort of get health services for them and their families. So this has actually come to us from Tony Muzira, who is a Ugandan youth activist, who says, how can young people be mobilized in the COVID-19 response and make sure there's equitable healthcare in their countries? And maybe if I can come to you first, maybe, Your Excellency Fadil, sort of looking at this from the perspective of the African Union, are you particularly engaging the youth in your UHC campaign? Oh. Dr. Fadil? I'm sorry, I'm not sure she caught the question.
Can I come in?
Yes, please. So we're asking about the youth and the role
because
of
I just wanted to comment on this area because for the universal health coverage, for our different programs, we always tend to engage youth and youth organizations. And we mobilize youth. And when I mentioned the volunteers that worked with us during Ebola and that they are working with us now as responders, all of them, they are young. Mm-hmm. They are young and they are, if not all, most of them, they are under 30. And they are very enthusiastic about playing a role in this fight against COVID-19. Not only that, we have the Office of the Youth Envoy, the African Union Youth Envoy. They have created their own initiative. They called it African Youth on COVID-19, African Youth Front on COVID-19. And they have developed this initiative. Part of it, it is a digital platform, but they are also calling on young Africans to join in raising awareness around COVID-19, to join as community health workers, to join as part of the tracing teams. So I think they have a role African youth. They have a role themselves. They are working on identifying these roles. They are engaging with us as an African Union through the Youth Envoy Office, but also directly in the areas that they used to work with us, whether in universal health coverage or areas of mother and child health. So I think they are engaged, but we need to create more opportunities for them to have more engagement with African youth. Thank you.
Great, thank you very much indeed. And there's a related question here actually, and this is from Angela Nkugu from, she doesn't say where she's from, but she's asking around primary health care, you know, that we recognize again to get maximum value for money out of health systems, you know, how important is primary health care. Maybe if I can talk to you about this one, Dr. Rao, you know, that you're interested in primary health care and how important that is to UHC. Is that something that Rockefeller Foundation is particularly pursuing? Oh, just unmute it again, please, sorry.
Could you ask me that again, Rob? I just want to make sure I heard the whole question.
No, absolutely. So we're, it's a question from Angela Nkugu, who asks about primary healthcare and the role of primary healthcare in achieving universal health coverage. And I know that, you know, WHO in particular is encouraging this. What's your view as a sort of philanthropic organization?
So absolutely, we believe primary healthcare is the basis. Without that, we are not going to be able to achieve universal health coverage. To us, the whole primary healthcare concept is not just the primary health center, but the community and the hut. And so if the mother and child and the continuum between the hut and where she is to the primary health center, that whole concept is primary health care. And then being able to link it upwards to the primary, secondary, tertiary health in terms of the data platforms, in terms of medical care. But we know that health is not just health care. Health is also health. It's the food you eat, the air you breathe, where you live, and all that should encompass primary health. And so we shouldn't be just thinking of it from the medical health care point of view, which is doctors, hospitals, and medicines. So if we can really extrapolate primary health care to include health, social determinants of health, and link that from data and data technology back into the primary health care, and that whole thing then links to the healthcare system, that to us is the way to do it, and that's what we are focused on.
Thank you very much. And I think what, you know, one thing, of course, we are really recognizing, as you're saying there, that health is much more than just about hospitals, and you know, that I think this is this recognition that this crisis.
So Rob, there is actually data on that. Only 25% of your health depends on hospitals, healthcare. In fact, by the time you get to healthcare, it's too late. You have the disease, and so 75% of your health depends on the social determinants, on the food you eat and the air you breathe and the violence you're exposed to. So it's just 25%, and also it's too late by the time you come into the healthcare system.
Yeah, absolutely. And I think another thing that we're finding, of course, is that even though you might ostensibly have, you know, a really great universal health system and very good public health systems, is the role of political leadership. And, you know, it's something that President Kikwete mentioned right at the start. And I think, you know, it's interesting if you look at the preparedness index, that supposedly the most prepared country was the United States, and the UK was number 2. And, you know, if you look at the impact of the pandemic so far, you know, we have got the highest death rates. And I think there's a feature about the poor performance of our political leaders in our respective countries. And you look at Brazil as well in this aspect. So I think we are recognizing more and more this being around having primary health care, having very much sort of integrating public health into your system, but the vital role for political leadership. And I know that's something the One by One campaign and the African Union is very much promoting, and you know, really commend those efforts. And of course, the other area that we've only touched upon a little bit, but I think we might move into now, and you mentioned it, to Naveen, is the social determinants of health. And you know, this may be being sort of the third pillar that we need to recognize, that you need healthy populations, and that a healthy population is going to be much more robust to you know, the pandemic. So to finish off our webinar today, I'd like to hand it back over to our co-host, please. And first of all, very much thank my wonderful panel who've given us such great insights into UHC from their perspective. So thank you very much indeed to the panel. And I'll now hand over to Stephanie, one of our co-hosts today, who I think is going to sort of take us into more of the issues around the social determinants of health as well. So thank you very much from London.
Indeed, indeed. Thank you so much. Thank you for this wonderful discussion. And I am so sorry for the tech glitches earlier. But I wanted to walk you through a little bit this fantastic report that we have put together. And thank all of you panelists again. Thank you to the Access Challenge, obviously, for this partnership with the Harvard Global Health Institute. There's really been behind this work sort of a team that has worked hard on this report. Africa Leads the Way, Harnessing Multi-sectoral Collaboration to Achieve UHC. So if you hang on for a couple more minutes, I'll share with you the story of this framework that we created in this report. And that's a framework we hope will be useful for many of you, no matter if you work in an NGO or in a government or in a pharmaceutical company or in a rural clinic. We've heard such insightful comments already, right? Health is not just healthcare. That's what this report is about. And we really hope, there are the slides. So let's go all the way to the first one, Caroline. You'll just try to catch up with me. We're on slide 1. So at the core of this work is the truth that we all know and that resonates deeply with our work and life experiences, and that we've already heard about in this conversation, but that too often feels overwhelming, and especially in a crisis like right now, you know, a little distracting. It's the truth that when it comes to our health and well-being, everything is connected. The truth that a new mother should not have to weigh the risks of giving birth in a health facility without clean water. It's the truth that the health of our children can only be as good as the health of the soil from which we grow our food and the health of the air that we breathe. And of course, it's the truth that when a pandemic hits, our response is only as good as our least developed health system. We all know this, yet our programs and policies too often do not reflect this. And with this report, we hope to move all of us a step forward towards concrete ways to acknowledge more of these connections and start working together across sectors on more holistic approaches. And that's why at the end of the seminar, you know, there was a lot about how we utilize the pandemic as an opportunity to build better health systems. You'll also hear a bit about climate change. That's because when it comes to people's health, these crises are connected. And we believe that by showing these connections, we can develop programs and policies that make us more resilient towards these threats, not just the current and pressing one. So in this report, you will find a new framework that helps you look at the root causes of health outcomes. It talks about health promotion and the latest science on the 3 key building blocks of healthy lives: nutrition, water, and clean air; health prevention, the role of community in building better health for all; and it gives quick examples and action items. The report has been informed by a set of diverse partners who participated in the 2019 1x1 conference, Achieving UHC, A Sustainable Future for Africa. Caroline, if you can just hold it for a second, we're not there yet. So experts from many fields, including water, air, nutrition, energy, and finance, have all weighed in, and you will find their quotes and insights and lessons learned throughout the report. So when we think about universal health coverage, we usually think about basic health care, and that is what this wheel is about that you are now seeing on the screen. This is the framework that we created that helps us wrap our minds around how we can bring social determinants of health, those other 75%, into this conversation. So when we think about basic health care, right, we think about community clinics and primary care and surgery, and we think about drugs and health records and how we provide everyone with access to the best possible care for whatever illness has befallen them. It's a disease-based model. We think about and see people when something is wrong. Now, of course, we know that prevention is important too. That's why preventative medicine is also part of UHC. Interventions provide better nutrition for babies and mothers who are iron and zinc deficient. Bed nets help prevent the spread of malaria. Toilets prevent the spread of many diseases. And these interventions are still disease-based. When we design them, we think about preventing an infection or a birth defect based on what we know about how people get sick. And of course, there's nothing wrong with that. And part 2 of our report explains how to build better, more community-informed prevention focus on health and not disease, as you all have already talked about. But what if these approaches don't actually solve the underlying root causes of these health issues and illnesses? Our framework allows you to look further upstream. So here now we're getting to the green. It provides you with a whole government approach to understanding what it will take to assemble the building blocks for human health. For example, what if we better understood the agricultural and economic realities that lead to malnutrition in the first place? What if we bring together health, finance, and agricultural leaders to see if by collaborating, they can start addressing some of the root causes of diseases that come from malnutrition? And what if we investigated and understood the real trade-offs between, say, an energy policy and its impact on people's health? What if we could estimate the downstream costs of the healthcare system and that it will have to pay because it will end up caring for all those people whose health is compromised by, for example, indoor air pollution from open fires, which can lead to cardiovascular and pulmonary problems, stroke and lung cancer, to name just a few of the health risks. So Caroline, if you want to pull up the report and just show it so people can see it, I think that would be lovely. So this is where climate change enters the picture. The African continent is highly vulnerable to the impacts of climate change. Hotter heat waves, longer and more frequent droughts, and higher sea levels are just some of the upcoming challenges. Climate change is primarily still viewed, excuse me, as an environmental crisis, and yet it's also so clearly a public health crisis. Just remember Cape Town counting down to day 0, the day when the city of 3.7 million residents would run and then did run out of fresh water. In already stressed ecosystems and resource-constrained communities, the downstream effects of climate change are significant. They include heat-related illnesses, injuries and losses due to flooding, an increase in asthma, respiratory and cardiovascular condition from air pollution. I have a long list here that I won't read to you all. We know this, forced migration, undernutrition, so many more. The prevalence of these diseases will only rise. So it's no question that if we want to build strong UHC systems by 2030, we need to use these multi-sector approaches to make them climate resilient. And our report lays out how we can do that. How we can do both, actually, build more climate resilient and more holistic approaches to UHC by working across sectors and disciplines. So here's what makes all of us who have worked on this report so optimistic. Once we make these connections, we realize that solutions that address an upstream root cause also make us much more resilient against other threats. Multi-sectoral approaches also ensure quality. They can bring reliable energy and access to clean water and sanitation to health facilities, as Marianne has already mentioned, for example. And looking upstream also has an important impact on a nation's bottom line. The promotion of health always costs less than the treatment of disease, not to mention the productivity gained when people are healthy and eager to work. In Zambia, for example, the National Climate Change Response Strategy includes specific goals to encourage crop diversification through cultivating indigenous and drought-tolerant crops, such as millet and sweet potatoes. Diversifying crops doesn't just help with droughts, it helps combat malnutrition and all the devastating health impacts. There are many more examples in the report. I give you just one more from Senegal. The country has instituted an action plan that outlines policies that subsidize the construction of sewer connections because cost is the most significant barrier for the poor in accessing these resources and services. With these concrete examples, we invite you to explore this report, to send us your thoughts and feedback. Tell us about the related work that you're already doing. And we hope that this carefully curated collection of experiences of our conference speakers, the latest research, cases and action items, helps you think through who else could be at the table the next time you meet with your team to solve a problem. By embracing the notion that looking upstream in the end helps us save both lives and resources, African leaders can lead the way to a multi-sectoral approach to UHC that places the person at the center of the health system. A way that focuses on the development of health, water, environmental, food, and energy policies that ensure human health is the primary collective goal. How we can do this even in a crisis, well, that's what your conversation already touched on. So thank you so much to everyone who worked so hard on making this happen. Thank you for your commitment and leadership, all of you, both our fantastic panelists, but also our participants. I still see over 200 people on this call. Thank you for the work that you do. And with this, I'll hand it over to Kate for some closing comments. You're muted. Kate, you're muted.
Thank you, Stephanie, and sympathy for the technical difficulties. It's just emblematic of the problems we're all facing across, and so it keeps us all focused on what we need to do. On behalf of the 1 by 1 campaign and the Harvard Global Health Institute, thank you to all of you for taking the time to attend this webinar. The next 12 months are a critical time for the Health for All movement, especially in light of the COVID-19 pandemic. Thank you to Her Excellency Amira Fadil and President Kikwete's leadership. We look forward to working with them on the upcoming ministerial meeting on UHC in Africa. We welcome each of you to join President Kikwete, the African Union, the Africa CDC, and us in this effort on the 1 by 1 campaign. Together, we have a historic opportunity to use this pandemic as a wake-up call for policymakers and an opportunity to strengthen primary health care as the foundation and future of health for all. Thank you all.